So week 2 pediatrics is going to be infants, toddlers, and preschoolers. These are your little kids. There's a lot of interesting information. There is a lot of growth and development, especially with your infants. So we're going to do a PowerPoint first. And then I have a Kahoot. It's 60 questions long, hitting you with things over and over and over again, trying to make sure that you understand it. I don't want you to memorize. Memorization doesn't work anymore at this level. You've got to start putting pieces together, okay? So let's go ahead. Anybody with any questions, comments, concerns, anything? This week you just have a discussion question. That's all that's due. By the end of this week, I'll be sending out a exam review and an exam PowerPoint for exam 1. So by Friday, because week 3 is going to be your all the reviews, and then week 4 is your exam, okay? So I am right now looking at the PowerPoint. I make the study guides, I make the Kahoots, I make the PowerPoints. So I'm just going to go back, making sure those concepts are really well covered, okay? So let's go ahead. Honestly, I think the littler kids are probably my favorite. They're so naive. They are just so pure. And most of all, when they tell you something hurts, it really hurts. If a child is telling you and crying and boo-boo and it really hurts, you know that. In adults, sometimes they don't react the same and sometimes over-exaggerate. But children don't. They're pure. That's why I love them. So let's go ahead and look at infants and break down growth and development. Probably the most difficult part of pediatrics is knowing what do they do first, what comes next, okay? For instance, there are 2 types of movement. We call it fine motor and gross motor. We're going to get into those things. So what's the first thing a baby can do? Their motor, their muscles. And that's lifting their head up. That's number 1. So that's part of gross motor. And then it's getting on their knees and crawling and creeping and walking. That's all motor, but it starts with lifting the head, okay? So babies are born. They can't even lift their head, right? They don't know how to suck, swallow, and breathe. They were inside mommy. They come out, they cry, and then immediately we stick something in their mouth, right? Whether it's breast, whether it's bottle. So this baby's learning that. These children go from not moving, and let's say born at 7 pounds, by 1 year old, they are now walking and talking and have tripled their birth weight. And at 6 months, they double it. Now, I've got a brand new newborn in the house. My daughter had one the end of April, and I'm watching all of these neat things all over again. The turning, that inability to move anything initially, and now almost 3 months old, is able to lift his head up and have more muscle control. It's amazing the amount has changed. Now, how do we get all that good cognition? Well, you got to feed it, right? So nutrition is what we need. As long as they're getting good nutrition, their central nervous system, their brain, their muscles are going to work the best. If we see delays, like they're not lifting their head up by 6 months, that's a delay. They should be reported. Something's going on. Was it nutrition or is it something physiologic? You don't know. So you always make sure that they eat properly. Now, at birth, babies lose up to about 10% of their body weight. And then they start gaining weight, right? 5 to 7 ounces per week. Infants eat. They're eating all the time, but they're gaining an inch every month. They're doubling their birth weight by 6 months. So they have to eat a lot to gain that weight so they get taller and their brain's working. So now they're starting to get up and move and all of those things, right? And what I always see is ever see a baby all of a sudden look thin, and all of a sudden their cheeks get a little pudgier again, and they get taller. And it is basic. I call it stair step. It's like all of a sudden they get a little pudgy, and then they grow taller. They get a little pudgy, and they grow taller. And that's absolutely normal in infants. Now, infants, let's look at what happens. You all received a vital sign sheet, and if not, I'll send it back out again. That vital sign sheet is telling you normal heart rates for any type of child. A neonate, which is the first 4 weeks of life, the first 28 days, their normal heart rate is 140 to 160 at rest, and that's normal. If they're crying, it could go over 200, and that's absolutely normal. Respiratory rate is 40 to 60. Now, if that was me, I'd be in big trouble, right? Be too much of a heart rate, too much of respiratory rate, and I need to have an intervention. But a neonate is perfect. It's normal. You need to know normals and how to relate that. Okay. Now, babies are born, and they're born with all of mom's blood and red blood cells and iron and hemoglobin and hematocrit, all that good stuff. Well, we know all cells do not start growing immediately. Somewhere about that 6-month period, that's when the body starts generating. So what does that mean? So initially, you've got great hemoglobin hematocrit, but cells die and your body's not making any. So about 6 months, these children have lower hemoglobin hematocrits, and we expect it. Not uncommon for babies born with a hemoglobin of 14, and at 6 months, it's 9 or 10. And as long as they're not symptomatic, it's okay, all right? Now, their heads. And this is another thing in infants, I think it's one of the first things I look at when I'm assessing these younger infants, like less than 1 year. There's two fontanelles. There's one in the back of the head called the posterior. Usually before you even know it's there, it's already closed. 6 to 8 weeks, it's gone. Now, the one on top of the head, that soft spot, that fontanelle, the anterior fontanelle, usually somewhere before a year and a half or 18 months, it closes. But that fontanelle is going to tell you if there's too much fluid in their brain or they're dehydrated, then it will be sunken. That fontanelle is a great assessment tool with infants, and assessing it when they're quiet, not screaming and yelling. Another thing infants start with, they can't see good. It's blurry, it's black and white. And all of a sudden, their eyes work separate. So there's no depth perception at all. Then they figure out how the eyes work together, and now I can reach and grab that, whatever I want. Now, again, immune system comes with mom, right? But after that, the baby needs to acquire their immune system by giving them their immunizations. Now, babies, by 6 to 8 weeks, these babies can produce that antigen that make it when we introduce these sort of immunizations to them, okay? Know that we're giving their immunizations, we are protecting them in many different ways. Babies born that cheese, I call it cheese because it looks like cottage cheese when they're born, and it's a vernix, but basically it's like a coating on their skin. It's protecting them. So babies' immune system, remember, they're very, very susceptible to infections. If the baby is breastfed, they have a higher chance of being protected. Because when do we start giving immunizations to babies? Well, hepatitis B at birth. And then 2 months, 4 months, 6 months, there's 4 or 5 that we're giving all at the same time. And then at 6 months, we're also giving the flu shot too. So all of this stuff makes that baby with a strong immune system. Now at birth, babies are born, they come out of mom, and they're wet. They were floating in fluid, right? Because they were floating with fluid, they come out, and if it's in a cooler atmosphere, they're going to shake and they're going to shiver. And that shaking and shivering actually burns calories. And we can see how important nutrition is. And these infants are tiny. They don't eat much to start with. So they need every calorie and to save every calorie they can. Now we mentioned gross motor, right? That's the head, that's movement, get on the knees, that's crawling, that's getting on the couch and crawling around, creeping around, and that's trying to take a step by 12 months. Well, the other one is fine motor. Think of fine, F, fingers, right? Starts with an F, fingers, fine motor. Now, at birth, if you touch or go next to a baby's hand, there is a reflex called reflex palmar grasp. So mommy puts the finger in and the baby grasps it. And they always say, "Oh, look, my baby's giving me a hug. My baby loves me." Don't tell them it's a reflex. Let that poor mother feel like, yes, that baby did love me and did hug my finger. Okay. So initially, it's a reflex. Somewhere after that, about 5, 6 months, now we're starting to voluntarily grab that rattle. Okay. 7 months, we can change hands. Remember, these babies didn't know how to suck, swallow, and breathe at birth. They didn't know how to put their hand around something. All right. And then somewhere about 10 months, after 8 months, where these children now, these infants, are sitting unsupported so they can sit in a high chair now, right? And you put those little puffs or Cheerios or little pieces of something for them. They take their fingers and they pick it up. And this is called a pincer grasp. But they don't start like this fine pincer grasp. It starts out with the hand smushing and sort of getting it in there. And then it becomes that fine pincer grasp. Then what do they do with their fingers? About 11 months, they can take things out of a container. They couldn't do it before then. I mean, some might do it at 8 months or 9 months. Some might not do it till 12 months. But as long as all of it going forward in their fine motor development, we're doing good. And then they say should at least build a tower of blocks with two of them. My little Christian that I always talk about, he did 3 or 4 the first year. He loves blocks, loves to build things. So fine motor, fingers, gross motor, get up and go, go, go movement. So gross motor is the head, and then we start rolling over. At 5 months, they can go from their belly and turn over to their backs. That's the easiest way. They cannot go from their back to their belly. It's a little bit harder to do, about 6 months. So by 6 months, they're completely rolling over. Why do I need to know that? Safety. What if they're in a changer, on a bed, on the dining room table, in a little city chair? These kids get giggle, wiggle, and they can fall. I mean, my son fell on the floor, but it was only 6 inches and it was a big shag carpet back then. So it was soft, but it happened. Safety, safety, safety is what we'll be teaching there. And as I said, sitting unsupported at 8 months. And then they're on their backs, and now they can get up and they can sit by 10 months. So the progression goes from easy to more involved. Now, cephalocaudal head, that means the head got up and it moved. And then caudal, that means feet. Now I'm walking. That's all about infants. As I said, it goes, completely rolling over by 6 months, and then they get up on their knees and they start crawling. I always notice they go backwards before they go forwards. And if you are a parent or you're around children, for the case of pediatrics, forget you have them, because the book is going to be different than what your child did. For instance, they do tell you that they should walk by 12 months. Let me tell you, in my case, my 2 children never walked at 12 months, not even a step. They'd fall right down. But at 15 months, they were running. They never took 2 steps. They took 60 was the first time. So again, they're going forward. You're doing okay. Now, nutrition. You've heard me talk about it. One of the most important things that we make sure that our children get. So for the first 6 months of life, only breast milk or iron fortified formula or a combination of them. And the reason why we're giving iron is because the red blood cells, making sure they have enough energy so they can eat, so they can grow, right? Because mommy's hemoglobin is dying off those red blood cells. So we're going to give iron and maximize how much can be there. Breastfeeding is recommended for the first 6 months of life. And then at 6 months, you can add on some sort of foods. And it should be breastfeeding or iron fortified formula for the first year of life. Breastfeeding, 8 to 10 minutes per breast. And a baby is getting enough breast milk, because it's like, all right, the kid was in a newborn ICU and I looked at the bottle and it was 25 mLs they were taking, and I don't know because he's on the breast. You know what I tell the mother? If they're having wet diapers and they're calm, they're getting enough milk. And when you go to the doctor, they're gaining weight. You're showing nutrition. You're feeding the baby enough. Any breastfed baby should be getting vitamin D. It's part of the muscles and the growing. As I said, 10% body weight is lost at birth. And by 2 weeks, they should be back where they should be. And then 6 to 8 wet diapers, stool, urine, doesn't matter. Breastfed babies usually have stool in every diaper change. It's just part of them. And as I said, they're going to be gaining after the first 2 weeks, 2 months of life. Now, why do we wait till 6 months old to feed babies? Well, it's changed, in many, many years. Back when my kids were little, they had no tell you when to give fruits or vegetables. I think it was at 4 weeks. My oldest was getting some fruits. And yes, this is what his stool looked like. It got really soft, and then you could see little pieces of that fruit or vegetable I was giving, because after many, many years of research, it was determined that the GI tract in an infant is extremely immature. And anything besides milk, it's not going to be absorbed. And your body's working so hard to digest it, you're burning all the calories that could have been in the food. So it's better just to have milk, breastfed, or iron fortified formula the first 6 months of life. Okay. Now, second 6 months of life, we're going to be adding fruits and vegetables. Usually, the first one that we add is rice cereal, the most, hypoallergenic food there is. Rarely are people allergic to rice. So that's usually rice cereal where we start. And remember, one at a time. Wait 4 to 7 days before introducing something else, because children on the first taste can have allergies, and we don't want to have allergies like this child. It looks like eczema all over this child, right? And it could be due to foods that the kid's eating. So we know food, and there's allergies. Christian can't have peanuts. Walnuts, tree nuts. He does. He starts to blow up and coughing. And we found that at a very young age. So we just make sure the kid knows, does it have nuts? And he asks the question all the time. Since he's been about 2 years old, he understood it. So what are sensitivity? The food, allergies, and then you have intolerances. Some people eat cucumbers and they give you horrible gas and it's not worth eating, or gives you a little bit of diarrhea or stomach cramps. That could be an intolerance, that you just avoid the foods because they don't do well in your body. We know that sometimes with these allergies, we can build up sensitivities and work with that if it's a big thing, because we don't want this child to be out, because every exposure increases the severity of a food allergy, which could go anaphylactic, right? Now, this eczema, it's all over the place. One of the things with eczema is keeping this child's skin without infection. Again, hand washing, right? Child hand washing, you hand washing. And then, of course, if we can prevent giving this medications or foods or anything to this child, right? And trying to desensitize it to them. Now, babies, they do sleep a lot initially, but we know that first week they don't sleep all night long. They only sleep all day long. And then all of a sudden they turn around and they're gone. By 3 to 4 months, they should be sleeping 9 to 11 hours. Breastfed babies, will wake more frequently. They say breast milk is thinner, it's not as thick, and it requires every 2 to 3 hours versus 3 to 4 hours on formula. And we know babies wake up, they eat, they wake a little bit, and then they take a nap. And they wake up and they eat, and then play a little bit and take a nap. And that's all part of it. Now, our book says walkers, swings, and playpens are not necessary. You know, if you have them, you have them, right? Dental health. At 6 months, they say that's when the first tooth could come in. It doesn't mean every child gets a tooth at 6 months. Again, my kid never had them until about 15 months again, and all of a sudden they had 7 teeth come in. So again, as long as you can feel them, they're coming, we're doing good. Now, once we have teeth coming in, you should just take a toothbrush, soft, with just water and just scrub the teeth just to get the sugar off, because sugar can rot the teeth. So no propping that bottle, no milk, no juice in bed. Anything, it needs to be water. There's a lot of question marks regarding using a pacifier. Do we or don't we? Is it a good thing or is it not a good thing? Well, pacifiers give this child a device that can self-soothe them. How do children, infants, soothe themselves? Did you ever watch them? Where does everything go when it's in their hands? Right to their mouth. They explore the world in their mouth, right? When they are upset, they put their finger or a pacifier and they self-soothe. So a pacifier is a parental choice, but a pacifier is with a little sugar water. It's like you gave a child morphine, like during procedures. My little grandson had to, because of a very tight foreskin, had to have a circumcision, and they did it with only a pacifier with sugar water. Isn't that amazing? And then you don't have to take morphine or any other things. And the only way that this kid was upset is because we had to tie him down to do the circumcision. We had to strap him in. So again, pacifiers, controversial, but they're good. They can help soothe, and they can be used to help pain. Now, how do you know how many teeth they should have? It's just how old are they minus 6, because 6 months is where they should, and that just shows you how many they should have. Immunizations. Well, we know at that 2 months, 4 months, 6 months, there's these big double page book for you of all the immunizations that we do give. The number one we give, Hep B at hospital, okay? And then after that, we give bundles and bundles and bundles of immunization at 2, 4, 6 months. The thing is the pain that's involved with giving these immunizations. We can do numbing creams. We can put a cold pack and numb the area with cold. We could do a lot of things. Also, after getting those immunizations, just take the knees and pick them up to the chest like a bicycle, because they put them in the vastus lataris, right, into the thigh. So you move that medicine around, it's going to be a less chance of being hard. All right. Colic. Colic is a problem with gas. And usually after a couple months, it could go away, but it is very difficult. These children are always in pain. They have gas, they sleep, and wake up all night long. It's difficult. They have to learn how to feed them a little bit better. Maybe that's it. Maybe they need some sort of, gas medicine for this child. Maybe it's the formula. Maybe it's the breast milk. Maybe. We don't always know, but it is a severe abdominal pain, and they usually grow out of it. Now, failure to thrive. Failure to thrive is when a baby is underweight. Now, how do we know when they are underweight? Well, they're born at 7 pounds and it's 6 months and they weigh 10 pounds. Are they underweight? They should double the birth weight, should be 14. They're only 10. So that's a failure to thrive. What they do is they do a complete workup, a GI, laboratories, x-rays, all sorts of stuff. Sometimes it's metabolic, sometimes it's food intolerances. But remember, an infant grows so much and they're not growing where they should be. Not only are they going to be small and underweight, they're also cognitively are not going to be up on their knees trying to crawl, rolling over. No, because the fuel hasn't fed their brain. Now, today it's all about back to sleep, right? SIDS death has been something that pediatrics has worked with for as long as I've been a pediatric nurse, since the 90s, actually. So they've done a lot of research on newborn ICU children. And what they found, initially they said you couldn't put the babies on their tummies to go to sleep, but you could on the side or back. Well, they found out on their side there was still an increase of SIDS death. So what they say is you have to have this child on their back to sleep. Now, they can get a flat head, right? And parents will say if they're always on their back, their head's going to be flat. So what would you teach these parents? Well, if it was very severe, maybe due to a prolonged newborn ICU admission, and one of their heads is flat. Well, what we do with that is we do tummy time. So you do tummy time several times a day, and that helps that head round out. If you ever feel the scalp on an infant, it's very soft and tender and pliable. You can, they'll sit up and it will go, it will be fine again. Another thing is that diaper rash, right? That sort of looks like yeast, those little round little dots, and it requires some medication. Remember, one of the things that will be guaranteed to keep you awake all night long is an infant with a diaper rash. So how do you treat diaper rash? Well, you wash it soap and water, and if it requires medicine, you put on it and you change them frequently. And the other thing is cradle cap. That's that white, flaky stuff on a infant's head. And how do we treat it? Well, it's dry, it's flaky, right? So we need to moisten it. We can still, when you're giving the bath, soap and water normally, and then put some sort of baby oil or olive oil, leave it overnight, and comb it with a little fine tooth comb gently. Now, it's not going to take care of it the first time, but it might over time, it's going to look better and better. I've mentioned SIDS and what it's about and that positional thing. Let me tell you those risk factors. It is mostly males, and it is for children that are not breastfed. Those are the two big ones. If you put a baby on their tummies to sleep, there's increased risk. Smoke is always going to be a risk factor, whether it's SIDS death or ear upper respiratory infections. Smoking can cause all of these things in infants. Okay. Also, not having your baby over hot. You tend to, many parents, and I've taught them a lot about being in a onesie with a onesie underneath with a big blanket over it, and it's 80 degrees outside. I mean, that's hot. So teaching them not to overheat. Another thing is keeping up with immunizations, and then sleeping, co-sleeping is what it's called. And, I've actually seen a case where there was a larger father who had the baby in bed with him and rolled over, and the baby came in dead on arrival. So it does happen. So again, teaching, teaching, teaching. The other thing that happens with newborn infants up till about the age of 3 months are the big, big, big ones that we worry about is something called an ALTI. It's an apparent life-threatening event. It looks like choking, okay? It's the infant. They turn blue and they stop breathing. It's like they choked. That's what it looks like. but we take it extremely serious. Parents bring them in, they're going to be admitted. We're going to do a neurological and a GI workup and making sure that you're okay. An apparent life-threatening event. If you look at that picture there, that is an apnea monitor, and it's just put on by a Velcro strap. And it's a great tool, especially when you've had these infants with alt-T event, send them home on it. And it's also sent home on some other high acuity babies that are going home that still need to be monitored. But the alarm on that is so loud and annoying, it wakes up everybody when it goes off. So it is a good thing. Again, safety, safety, motor vehicles. They can sit in an infant seat, okay? Rear facing up to the age of 2 years old or 30 pounds. After 2, they can go front facing. It has to be in that 5-point harness, snugly fit. And you could take baby blankets, make them into rolls, and tuck really those little tiny little newborn infants in that, those blanket rolls tucking in, and a nice good harness. And that's what we want, rear facing. You know, today they're doing a lot of teaching to parents on CPR. And the other thing that we should look at is water safety. I mean, infants are going to start to crawl. They're going to crawl out the back door and they're going to go in the pool. And it happened to me, to my first son, but we heard it right away and got him out. But the pool was green. So immediately kid had a shower, right? But it does happen and it's that quick. And safety and water safety, very important. So Letitia is a breastfed infant being seen in her clinic for a 6-month checkup. The mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? Well, what did I tell you about oral and children, infants?
It's normal.
Absolutely normal. I mean, how many older kids suck on, their shirt or suck on a pencil or something in their hand all the time, right? The mouth is where children explore the world. And the mouth is where, if we give them something to suck on, it's this comforting thing. And you could calm a child who's, very distressed. So we're going to go into some theorists. Now, theorists are hard to understand. But try to listen to me, and I try to make it as understandable as I can, all right? So, Erickson. Erickson talks about the people around them and how they interact with the infant, okay? What does an infant need from those people around them? They want to eat, they want to be burped, they want to be hugged, they want to be changed, right? So, an infant trusts that caregiver when they come in, when they cry all the time. I mean, maybe once they, took a little bit because whatever, but most of the time, that baby cries or coos or signals for help and somebody comes. That's trust. Now, there are times where sometimes it could be in a relationship that's abusive, could be in drugs, alcohol, something that's happened where that baby is not the first thing on the agenda. And these babies will cry longer periods of time, sometimes crying themselves back to sleep. This is mistrust. Okay. So, Erickson, I trust my caregiver because they come for me. I'm happy, I'm healthy, my needs are met. Mistrust. Nobody comes get me. I actually end up almost in despair. I sort of like give up. I stop crying because nobody's coming anyway. And infants, yes, they're that smart. Now, cognitive. Piaget is thinking, how do we go from not knowing how to suck, swallow, and breathe to be able to do a voluntary get that rattle and grasp it? So it's gone through a series of things. So we suck, swallow, breathe. Yes, we are. Because that child has learned it. We put it in there and they realize what to do it. Then, they're looking all over the place. Sometimes young babies, you can open your mouth, stick your tongue out at them, and they'll try to do it back. Or you make a little noise and and they'll do it back to you. This is all repetition. They don't know how to do this until you show them. Another thing is like what we call a schema. So it starts with, I had a reflex grasp and I grasped a rattle that you gave me. Well, a couple of months later, I grabbed it because I wanted it. Well, when I moved that rattle, it made noise. Oh, that's cute. And I move it more. Now I made more noise. So that's calming. I'm now playing, right? Then it falls and it hits the kid in the mouth. Oh, and you put it in the mouth. I like that too. They've just learned how to shake a rattle and how to get comfort from it with their mouth. That's all what Piaget says. Things build upon the others. They have to see it before they understand or know it, okay? And I know that's confusing. Now, there's two words that you always see: concrete and formal operations. And I just wanted to describe those separately because I think sensorimotor, pre-operational are all about those little basic little things. Sensorimotor is all about touching, mouth, and movement. It's just like that rattle I told you about, right? Pre-operational is now they're thinking a broom's a horsey, the arms out. I'm an airplane now. Again, thinking. We've seen a plane. Somebody did it. I'm going to do it too. Now, we get to school age. They want to do new things, but they don't have the mental capacity yet to figure it out. So once they've been shown it, that it's concrete, it's sitting there, I can touch it and feel it. I saw it before, I can replicate that, right? So they have to see it to do that again. Now, adolescents, think about you as an adolescent, formal operation. Mom told you you're not going out to the dance on Friday night because on Monday you got a D on your project and because you didn't do it, and you have to go to that dance on Friday night. This is an adolescent. They will figure out everything that they could possibly do to make mom change her mind and let me go. I took out the garbage. I made my bed. I did a load of laundry. I this, I that, right? This is what kids do, adolescents. They know if they give them a lot of good, they might give leeway. That's formal operations. Nobody taught them. They figured it out. Now we're looking at these infants. Now we're getting up into their body image. So body image, seeing who they are. They are, again, mouth. That's pleasure. That's comfort for them, right? And babies are starting to know who's mom and dad and nana and pop and all of that. There are certain things that happen with infants. They don't like other people a lot. That's stranger fear, right? What's the first thing you do when you get a baby in a doctor's office, a urgent care, or ER? You take him out of mother's arms and put him on a scale. They don't want to go. So I would always have the parents do it. And then later on, start, joking with a child and, making them comfortable. And then they'll come to me. But stranger fear, it's like that. Now, when they're younger, stranger fear, they just look away and don't want any part of it. As they get older, now they're looking at you, around the corner because it sort of interests them. Like, what do you want? Okay. And they want to know what you want. We know that separation anxiety is that you send them off to daycare and you're back to work after you had that baby. And that first day, that child is going to cry and break that mommy's heart, and that's just part of it. But then they learn the routine and they become okay with it. Know that infants cooing, and crying, and it goes on into learning words. And a lot of stuff is through play, with mommy, daddy, grandma, grandpa, aunt, uncle, sitting there and playing with these children. So toddlers. Toddler ages 1 to 3. And I love this Jerry Seinfeld quote. Having a 2-year-old is like having a blender without a lid. You turn it on and they're everywhere all at once. They love to get into everything, right? They get into the cabinets, the pots, the pans. If you have a wine rack too low, they'll get one of those. That was the one thing Christian did. He found a good bottle of red and it went all over the place. It crashed, of course. He's fine. But again, it's something we call them terrible too, but these children are learning their environment. They're exploring. It's this intense exploration from the moment they wake up to the moment they go for their naps or to bed. They are all about me, mine. I'm not sharing and I want it now. Temper tantrum. So, how do you deal with temper tantrums? Well, they say ignore the behavior as long as they're not going to hurt themselves or others. And again, they always are telling you no and no. So, as an infant, they tripled their birth weight. The first 6 months, they gained an inch a month. So that's at least 6 inches in length that they've grown. So it's quick, but you get to be a toddler. Toddlers don't eat as much. They don't need as much. They're not growing as fast. It's about 4 to 6 pounds a year, and you're not going to quadruple that birth weight. You've tripled it at 1 year old. It takes another year and a half to quadruple it. We're growing, and it's like 2 to 3 inches a year or 3 inches a year. Their legs are getting longer. They're getting more, less pudgy, longer. Their head at birth, remember, it was big. Heads at birth are bigger than their chest. Well, now the head and the chest are equal. One of the things about doing our developmental screens is to check head circumference and the chest circumference at this age, making sure. It's also checking, did that fontanelle by 1.5 years old, 18 months, did it close? These are things we're going to look for. The children are getting their systems more mature, their GI system, they're able to eat more. They eat more, 3 meals a day with some snacks in between. We know that children now are starting that potty training system, right? And potty training starts with bowel. They can tell that better, they can control it better. And then it goes to the urine. So growth and fine motor skills. Still, we're getting more and more dexterity, less awkward. We're doing about 2 to 15 months. We're using both hands a little more. And now we're throwing balls, walking up steps. Their eyes they weren't working together, the eyes. Now we're up to 20 to 40, and depth perception is really good. Now, one of the things that happens in toddlers is their hearing, their smell, and their taste and touch become more refined. That means what they taste, they don't like everything. Have you ever tasted baby formula or baby food or cereal? And infants love it. Yum, yum, yum. Well, they don't taste as well at that age, right? Now, as toddlers, these taste buds tend to develop, so now they become picky. I think that if you go to a list of foods toddlers want, it's chicken nuggets, it's macaroni and cheese, and apple juice. Bang, bang, bang. And I probably 90% of mothers will say, yep. So how do you get all that good stuff in them? So you've got to explore which ways in order to get them, good foods, because they literally become physiologic anorexic. They eat such little proportions now. Now, Erickson, what's Erickson? It's about how they deal with people around them, right? This is about social skills, dealing with people. Well, toddlers do not want anybody but themselves. They want to do it by themselves. They don't want to share their toys. It's mine and no and me. Autonomy, all about automatically me, mine, autonomy. Now, what's the shame and doubt? Well, if you have a toddler, ages 1 to 3, there's always going to be a person going behind them saying, be careful. Don't do that. Here, let me help you. Let me put your shirt on for you. Here, let me get the shoe. Here, don't do this. Don't do that. Oh, be careful. There's a hole there. Oh, you know, that helicopter mom, that's the shame and doubt. I don't think I can do that because my person of authority keeps saying, be careful, don't do that. You have to da 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 da. Okay? So that's automatically mine autonomy versus that person who's telling me, be careful, that helicopter mom. Again, negativism, no, no, no. What helps that toddler? You get a toddler has to go to a hospital. You're that nurse who's getting that child. How are you going to take care of them so that they're calm as possible? Well, we know with toddlers, especially toddlers, routines, that ritualization. They know when they wake up, they're getting breakfast. They know after breakfast, they're putting on their clothes and they're going to play. And they know they're going to take a nap. They know when things are coming. And some parents are to the point of crazy on that, but basically, good routines provides comfort. Now, Piaget, I've already talked, most of it. Basically, it's all about building upon what you know. So as we get older, it's something, there's a term here that you need to know, and it's what we call object permanence. Now, remember, they've never seen this cute little stuffy bear before. And you introduce this cute little stuffy bear and you put it next to your child when they're on tummy time. Now they've seen it. So you move it behind something that infant, even though it's not in sight, knows that it's there somewhere. And they go actively searching. That's object permanence. Even though it's not in sight, you know it's still there. This is the infants at a very young age. They still can do these sort of things. So again, excuse me, the toddlers, they're developing autonomy. I want to do it myself. Let me do it. And that shame and doubt, as I said, is that helicopter mom. No, no, me, mine, mine, mine. And again, that ritual, that routine helps these children be comfortable. Piaget with these children again, they're building upon number one. They've taken that block, that rattle, and they're shaking it around. Now they're getting older and they're seeing more, like putting arms out and be an airplane and riding the broom, and it's this, and making up their own little world. Okay, it's just whatever they're learning, they're applying it, whether it's proper or not. It's just what they're trying to do. It's like that exploration. So this is one of those sensory or motor things. So you got the child, you put them into the high chair, and you give them food, and usually on there you'll put a little sippy cup, right? So by accident, the child hits it and it goes on the floor. But what happens? Somebody comes right over to get it. So now they know, sippy cup, go on floor, somebody comes next to me, which is what I want. They are so smart. That's learning. So they're going to do it again and again and again. I thought you'd enjoy that. They're also learning that there's a mommy and a daddy, and they've got different things. Again, they're potty training. They're in the bathroom with mommy or daddy, right? It's not uncommon for children to touch themselves in those places. And I always just say, uh, do you have to go to the bathroom or you itch? Are you okay? All right, then get your hands out of your pants. Go wash your hands. I don't make a big deal out of it because they don't know they have these things. They're still learning. They're start learning. What does mommy do? What does daddy do? Learning these roles, really important. We know separation is a little bit easier as we get a little bit older. But again, how do we do it easier? Well, bring their special blanket, bring their special, bottle or pacifier, whatever, their little teddy bear, bring that. And that actually, that transitional objects to help them be comfortable and relaxed. Language. Well, we start out one-word sentences at 12 months. By 2 years old, they are learning a lot more words, and they don't necessarily speak all the words, but they understand a lot more than they can speak. So the one thing about toddlers is to have them sometimes show me, what are you telling me? You can't always see it, but they're trying really hard. As I said, their personal behavior, they want to be independent. They want to do everything for themselves. They are strong-willed, determined, and volatile, as in temper tantrum when they don't get what they want. But the other thing about toddlers, and I've seen it, where you're not feeling well. Let's say your knee hurts and you're sitting there, and the child comes up, toddler, ages 1 to 3, and you got a boo-boo. This is the time we'll give it a kiss, make it better, right? And those things, they're starting to feel other people's. Play. What's play good for? They're learning. They're being creative. Magical thinking going on here, right? So parallel play is toddlers, and you need to know this concept. Types of play. Toddlers, parallel. You think two lines next to each other, right? One toddler and another toddler. Toys and toys. They're playing next to each other, not sharing. This is my toys and these are my toys, and we're not sharing. That's parallel play, and that is toddlers. As I said, potty training, toilet training, they need to be ready, and they'll start telling you, they'll start holding their urine for over 2 hours, and it does get ready. You basically know when the child is ready, usually before 2.5, they say. Brothers and sisters, there always be rivalry, especially if you're the older and the little young one comes in, and I'm not the only one anymore, right? Temper tantrums, I think this is a good thing. We see them mostly at bedtime. You know, they don't want to miss a thing. They don't want to go to bed. So again, uh, bedtime routines do help get children to bed without those temper tantrums. Again, as I said, no, 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 me, mine, me do. And when toddlers get upset, there are stages of separation anxiety, right? So initially they scream and they're upset when mommy had to leave, for a little bit to go home, change clothes, whatever. That baby, that child in there, that toddler will start crying. And then all of a sudden they realize, well, they're not here. So they regress. They might suck their thumb. They might, have an accident where they've been trained before. And it's all telling you they're stressed. As I said, toddlers, they're in a physiologic anorexic state. They don't eat much at all. So being careful, number one, especially those who are on a special diet, for instance, a vegetarian diet, making sure when they don't eat that much at all, making sure that they're getting enough protein in their diet, right? And remember, if they're only on whole milk, after 1 year old, you switch them to whole milk. If they're still nutritionally need a little boost, they might need calcium and vitamin D supplements. And again, why was I concerned about protein in a vegetarian? Well, they don't have protein, they're not going to heal properly, right? And what are kids, especially toddlers, doing all the time? Falling down, scraping their knees, scraping their elbow. So again, making sure enough protein is good. Dental health. As they get older, you need to brush your teeth. They can use fluoride now, and they say you can floss. Now, children that are under 7, like first graders and down, they don't have the dexterity to floss correctly. So they say after 6 years old, and they can floss properly. Now, children love to put everything in their mouth, right? They love to put medicines in their mouth. So heavy metal poisoning. Sometimes in older buildings, the windowsills have lead paint on it. What do children love to do? They sit at the windowsill, right? And they chew on it. on the windowsill because most of them are teething. It could have lead in it. That is a big problem in some older cities, in the country. I mean, New York City, any city, might see those sort of things. So again, if we think that it's some sort of poisoning, number one, poison control should always be called, and then get that child where they need to go. Whether you vomit or don't vomit, that's all poison control to tell you. And how do you treat a lead ingestion? Well, there's medicines. It's chelation therapy, and it combines with the iron and you excrete it. Or there's a machine like this one that you're looking in the picture. It's an apheresis machine, and it could pull out just specific components of blood, which could pull out the lead. Again, any time you suspect any sort of ingestion of anything and you're not aware of it, number one, teaching parents call poison control first. Because sometimes if you make them vomit, you might just tear up the esophagus with a corrosive whatever they swallowed. Okay. So again, poison control first. Safety promotion, injury prevention. Any age child, big place that you need to be concerned is that motor vehicle, whether they're in it, driving it, or ran over by it. Unfortunately, I've seen, I think, 3 toddlers ran over by a car, by a next door neighbor, by an aunt, and by a father. And it wasn't because they were neglectful. The kid ran underneath it very quickly and they didn't catch him quick enough. So again, being safe, teaching these children. Also, car seats, knowing 30 pounds, 2 years, rear facing, and then turning it around. Okay. Number one, safety promotion in children's accidents is, and injury prevention is, motor vehicles. We know drowning. I live in South Florida. South Florida has water everywhere. So teaching good water safety. Burns, keeping those pot handles off of the, out so that the kid can grab it. Falls, making sure that the kid's now 6 months old, you're strapping them in wherever they are so they can't roll off and fall on the floor from the bed or the changing table. And again, just simple safety promotions. As I said, car seats and the center of the back seat. We like to put it behind the passenger seat, don't we? Because we can see them better, but they recommend the middle seat now. Gross motor skills. Again, here's some more things for you to look for. And preschoolers. So what are preschoolers? They're ready to go to school. Now you're going to see 2 different numbers. So I don't want you to be confused because it's okay. Ages 3 to 5 or 3 to 6. Now, my dissertation for my PhD was on school age children. And when I went searching for what ages it was, I saw 2 different numbers, 3 to 5 or 3 to 6. Let's just call it 3 to 6 because in school age, it's 6 to 12, according to the book. So we don't want to lose those 5-year-olds, okay? So school age children are getting ready to be able to sit down and pay attention, longer attention spans, and they need to get excited and ready to go to school. Again, body is very slow growing. It's 2.5 to 3 inches a year, 5 pounds a year. Now, 3 to 6 is a lot of ages. So there'll be considerate growth in those 3 years, but it's in minimal times, 2.5 to 3 inches per year. And again, preschoolers have a more easy time handling stress. Toddlers, they don't, and they like to be, routine and structure. With preschoolers, it's actually, they're a little bit more flexible. Gross motor skills. Look at this. Preschoolers. 1, walking, running, climbing, jumping. So that's hopscotch, right? Fine motors. Dressing, drawing, buttoning a button, things with the fingers, fine little things, using scissors. So Erickson, all about the way people around them that they interact, right? So sometimes when a child is doing some sort of task and this older person comes up and says that's not the way you do it, you need to do it this way, they feel like they've done something wrong, like they should know how to do it like that. Well, they don't. So it's basically this trying to do for, the family, the mother, the father, trying to be good. Okay. Another thing we could talk about with psychosocial development is another theorist called Kohlberg. And what Kohlberg says is there's right and there's wrong, and there's a consequence for each. And preschoolers understand this as punishment and reward. So preschoolers getting ready for school, parents and anybody around them needs to promote that positive attitude. We should be reading to our kids every day, or as much as we can. It gets them excited about reading books and going to school, et cetera, et cetera. Also, as younger kids, placing them in some extracurricular activities which promote teams, and they have to really pay attention for longer periods of time, helps getting them into school. So cognitive Piaget, what does it talk about? Well, we're starting to understand others a little bit more now. Okay. Not like we didn't, in the toddlers, right? Now, language is getting better, and something called time is completely understood. Well, what does that mean? They can't read a clock. They don't know that 2 p.m. We're going to be doing this. No, you're going to say, after we take our nap after lunch, we're going to be doing da 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 da. So its times are associated with events. When you wake up tomorrow morning, we're going to Disney. When the sun goes down tonight, grandma's coming over. I mean, whatever it is, time with an event. And have you ever listened to a preschooler playing by themselves? The language and the talk and this magical what they're doing in there, they create their own little worlds, and that's awesome. Like I said, Kohlberg, it's right and wrong and a consequence for it. And as I said, these preschoolers understand punishment and reward. So body image is getting more, they're understanding different colors, different eyes, different hair, different everything. They're just starting to learn. Now, another thing is children, and this in the medical field is a big deal. They feel if they fall down and get a boo-boo and it bleeds, they think all their insides are going to come out and they're going to die. Yes, Aaron.
Can we please get a restroom break?
Right after we're done with this, we're going to take a break.
Thank you.
We're almost done with preschool. Absolutely. It's only a couple more slides. So body image, as I said, why is that important to you? Well, if you have a child who needs to go to surgery, that's a preschooler, they're going to have a cut, right? They think their insides are going to fall out and they're going to bleed to death. And this is all they know. So again, making sure that we as nurses saying it's okay, here's a Band-Aid, fix the boo-boo. Spiritual development. Now, everybody has their own way of thinking about your spirituality. I don't have to believe in what you believe. But as a nurse, I need to give you an opportunity to practice your religion as long as it's not going to affect medical care, right? I can work into your prayers. I can work into whatever you have to do. We can work together. They're starting to learn mommy and daddy, right? This is that sexual exploration is going on that we're seeing. They're seeing those differences. Their social development, they're starting to have less stranger anxieties, fear of separation. And again, even though they're preschooler, yes, always, if they have to get in an admission to a hospital, always bring, as I said, those little things with them that can help them, that teddy bear, that blanket, that pillow, those jammies, whatever it is. And there's something called play therapy. Um, you can have a child describe an event that could have bothered them, right? And it does it through play, so they don't have to say it, they just have to show it. And we could find out how they were afraid and try to stop that fear. Sometimes children get one injection and it was wrong, something happened, and for life, they don't like any injections. Again, the language is getting more and more broad, more sophisticated, and they're even using words that aren't exactly correct. I know the big word that my little Christian loved was teleportation. Everything was going to be teleported in teleportation. You know, these words, and used in the wrong context, but it's normal for these children. Their social behavior, again, as I said, they're more of a pleaser, right? As I said, and they get upset when they don't please correctly. Maybe they put on the wrong shorts or the this or that. Again, they're not into that no, 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 me, mine, mine, mine. They're going to share now. And they're aware of the family and their culture and religions and foods, and they're starting to understand that now. Now, we talked about parallel play. This two children next to each other, not sharing, mine. That's toddlers. Preschoolers are more of associative play, which means two or more children playing together with the same toys. But there's no rules. That means nobody wins. It's not like playing a game of checkers and somebody wins in the end. Okay. That's associative play. It is normal to have imaginary playmates at this age. Now, if they're older, school age, that's not as normal. So knowing it, that to understand, that could be a mental problem, mental health problem. Dramatic play, again, is reacting out what had happened during whatever procedure, etc. Preschoolers, afraid of the dark. The boogeyman's going to get them, right? They don't like big dogs. They're afraid of them. It looks like they're going to get them. And again, they don't like things that can hurt them, whether, castrating them. I don't know why castration is the thing, but is one of them. But look at that. Objects or people associated with pain. That's me. I come with a needle, right? I come with that blood pressure cuff that squeezes too much. With these children, they're going to ask those questions about mom and dad and differences, etc. Again, you don't have to use big words where babies come from. Okay. What do they know, and enhance upon that? They do say that using the proper words, like, is it a vagina? Is it a penis? What are you going to call it? It's better to have the correct anatomic words, because if they're not with you, to that other person know what your word for that is. So that's what they say. And again, they're touching themselves, and now it's they are masturbating about ages of 4 and up. Speech problems, we usually see them here. Speech therapy can help correct it. Usually that's between 2 to 4 years old. Sleep problems, sometimes you get these night terrors. Children, these preschoolers can have it. My second grandson had night terrors, and they ended up having to put him on melatonin, something to help. So again, what were they, what they're from, being aware of it. Injury prevention. So again, number one injury, motor vehicles, get them in their car seats or their boosters, right? Again, wearing helmets, wearing safety equipment, very important. And again, getting these children getting to school, and now having other people, being their best friends, or getting their best friends at school. Other adults are going to be involved in them. Again, letting children know what's going to happen when they get there. Communicable diseases, preschool, toddlers, what do they do all day long? They take toys, they play with them, and they share them, and they swap spit all day long. And that's how we get viruses and GI and everything going all over the place, right? So again, biggest thing for for communicable diseases is to promote immunizations, that they do prevent diseases, and also hand washing using proper infection control. Conjunctivitis, infections in the eyes, how do we take care of it? Well, we need to get that crust out of there. We warm water and just inside out, and then put in ointment or drops. Always remember, if you put in ointment, tell that child you're going to see blurry for a second, right? Until it melts in there. Pinworms, they like to chew their nails, hands in their mouth, right? Go outside, play in the dirt. They get little eggs underneath it, and they put it in their mouth, and now they have pinworms. It's also, you can call it giarditis, or you could call it enterobiasis. They're basically worms, different sort of worms. Child neglect, something that you need to be aware of as a nurse, that it can happen. Any suspicion, report it. It's better to be safe than sorry. I've seen several horrific child abuse cases, but again, we reported it, and these children are safe today. There's something else that I don't know if you've heard of. It's called Munchausen syndrome. Munchausen syndrome is when the caregiver for a child keeps the child ill so that they get medical care. It's like an attention seeker. They could take like fluid from the toilet in a syringe and chuck it in their IVs, or take wounds and put dirt and stuff in them to keep them infected. So, as a nurse, if you suspect Munchausen, how do you take care of that child? If that person comes to the room, a staff member must be in there with them. Not all the time, but when that person comes. Also, they bring in any food or anything, you need to check. It could be something to continue that poisoning or whatever they're doing. Munchausen syndrome. I've only seen one of them in my whole career. Know that, sexual abuse, again, it's supporting the child, supporting, to get them safe. As a pediatric practitioner, your person to protect is the child, okay? And a question. Parents tell the nurse that their 3-year-old daughter and a male cousin of the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? Do 3-year-olds do that? They do. Do you want to make them feel bad for doing that? So they're always going to feel bad that they did something wrong? What we're going to do is say, come on, let's go watch a movie together. Wash your hands, right? And just draw the tension away from it. So let's go to a Kahoots. I'm going to stop. I'm going to give you 10 minutes because Aaron has to need 10 minutes now. And then we'll get out a little bit earlier too. How does that sound?